I'm Stephanie. I'm with Nine Health, and May is Mental Health Awareness Month. Today is the last day of May, so this is our last episode in a series we've done the whole month of May, covering different mental health topics. The first week we talked about mental health resources in Colorado. We talked about teen mental health resources. We talked about mindfulness. Today we're talking about the importance of relationships and companionship, specifically the new Senior Companion Program at Spark the Change Colorado. You'll see their logos behind me. They helped us with this series all month. Laura is with Spark the Change Colorado, so thank you for helping us all month.
Oh, you're welcome.
And let's just kind of get into it. I thank Spark the Change. Laura Kindergan is from Spark the Change Colorado. Olivia Veda Gonzalez, she is one of the companions with the Senior Companion Program, a volunteer with Spark the Change Colorado. And Carmelite Lucarelli, she is one of the clients for the Senior Companion Program, so we're going to get her thoughts on the program itself, how it's helped her, and what she thinks about it. So let's get into it. Laura, will you just kind of tell me what the new Senior Companion Program is all about?
Sure. First, I just want to give a brief history of the Senior Companion Program. It is a part of a national service program housed with the Corporation for National and Community Service. They also house, many people are familiar with AmeriCorps Vista. So there's a program called Senior Corps, and it's a 50-year-old living treasure. It has the Senior Companion Program, the Foster Grandparent Program, as well as the Retired and Senior Volunteer Program. And even 50 years ago, there was the understanding that older adults, many of them live in isolation, and or just with a little bit of support, they would be able to remain in their homes, living independently, rather than going into assisted living.
Okay.
And so that's the main purpose of the companionship program. Our volunteers, we seek out people who are 55 years or older,
Okay.
Who are able to pass a federal background check, as well as National Registry of Sexual Offense. So Olivia has gone through all of that.
Great.
They go through training. They are then, if they qualify for a stipend, it's very meager. It's $2.65 per hour. Then they are awarded that, as well as mileage reimbursement. And some meals are provided for them too. So what we're trying to do is do away with some of the barriers that our older adults may face when they volunteer.
Okay.
Yeah.
And Olivia, you are one of the volunteers for Spark the Change Colorado, specifically the Senior Companion Program. And again, we're talking about companionship, the Senior Companion Program at Spark the Change Colorado, if you're just joining us. You can ask us any questions here about the program or about mental health topics, and we'll try to get those answered for you. But Olivia, tell me how you became a volunteer and what you get to do as a volunteer.
Well, both Carmelite and I live at Cavote Senior Life. It's a very nice senior community, and I was asked if I wanted to participate in the program. I drive, so that's a plus with the program. And I was assigned a couple of people, and then others just like word of mouth. There's maybe 12, 13 volunteer clients, companions.
That you have?
That I have,
Okay.
yeah. There are 4 other companions, and they do different types of things. So that's how it got started. And then a lot of it in the beginning was like taking people to doctor appointments or to the grocery store, and but it's a little different than just being Uber or something. It's friendly. And
yeah, Olivia says, I'm not Uber.
Yeah.
It's about companionship.
I kind of felt that way in the beginning, but
Not a taxi.
I'm going to have it down now. So it's really nice, and it's nice for me. I mean, I had some spare time on my hands, and it's been really good for me, and I'm meeting people, different able-bodied, not so able-bodied, and people much older than me, maybe my age, and they all have just a world of experience and wisdom, and it's very rewarding. It's very rewarding.
Yeah, so you get something out of it too as being a volunteer.
Yeah.
And Carmelite, you're in the program, you're a client of the program, and Olivia is your companion. Tell me what you like about it and what you get out of it.
It's a lot of benefit. First of all, I don't have to go and wait for buses. Sometimes, some places the bus not reachable there. We went to a dance class
Dance class, nice.
once a week. Sometimes I go to shop in places that I can reach by myself. She helps me out. And also the YMCA, we can go swimming. And that's all. I feel good and healthy and able to do this.
And how did
Especially when I have help.
you find out about it and get into it?
Olivia was telling me.
Oh, right, you guys live in the same
Yeah.
complex.
And
So-
you had tried like to get to this
Yeah, I
senior
tried to
center,
get to the dancing place. It's in 1500.
Flat Park
Yeah, Flat
Senior
Park.
Center.
And I got lost. I took 2 buses and I got lost. I never got there. Took me 3 hours to
Sorry,
get
and
back.
hours of travel. Yeah.
So she mentioned it, and I said, "Well, maybe I can take you." And
Right.
and we both stay for the ballroom
Session.
dancing. It's so much fun and good for our health.
Yeah,
Yeah.
we feel real good.
Yeah, well, good. You guys are doing things good for your health, and then being together is good for your
Yeah.
health. So, Laura, talk about that a little bit too. The mental
Sure.
health benefits of really for anyone to have a
Yes.
companion or a friend, but for seniors especially as we age.
Right, exactly. Well, I do have a World Health Organization definition of health, and it's the state of complete physical, mental, and social well-being, and not merely the absence of disease. And so a lot of our seniors who live independently actually become socially isolated.
Right.
And social isolation is a big cause and companion to mental health issues. About 10 to 20% of Americans are living socially isolated. About 25% live alone. If you live alone, it doesn't necessarily mean that you're isolated, but when you stop having support systems, friends and family coming over, like Carmelite had said, trying to go out and do something in the community, like dancing, you're just unable to do that. So
Right, or without a car, it's such a challenge. Why would
Yeah.
you? It's almost just like, I'll just stay home. I'll just stay in my house.
Right.
Yeah, and studies have been done that people who are socially isolated have a 30 to 40% increased likelihood of death. It's almost like smoking 3/4 of pack of cigarettes every day. It's going to impact your health that much, and suicide is also among the highest group of people who commit suicide in the United States are age 45 to 64. And so the companionship, as we can explain later, just there's another person to be watching out. And some other mental health issues like hoarding also become really complicated in our older adults' lives. And just because of all of the morbidity that comes along with being socially isolated, it is costing our healthcare over $7 billion a year. And there is now a medical diagnosis of social isolation.
Right.
So it's a huge impact.
Right, and so a program like
Yeah.
this is very important, especially as we get older. And Carmelite, do you agree with that? Like, do you?
100%.
And you seem very social, just talking with you anyway.
Yeah.
Like you would kind of seek out friendships and companionship anyway.
Yes.
But how does it help you in that aspect to know that you have dance class coming up the next day or
I
something
feel
else?
relief that I can do those things. By myself, maybe I couldn't.
Right.
I feel
Yeah.
good.
Great to have Olivia's
I have
help.
great Olivia here.
Well, we're getting lots of feedback from Carmelita about you, but what do you hear from clients about the program when you've taken them somewhere? Do they give you any kind of feedback? Or?
Yeah, they can't believe it. They want a tip, and I no, we don't take tips.
I'm your friend, you don't need to
yeah,
tip me.
you don't have to tip me. And they're really, there are other programs. I mean, if you have to get somewhere, Accessorite or whatever. But so there's some restrictions as far as timing, and this one is a lot more flexible. And they have somebody with them for
Support.
Right.
support. Yeah.
And Olivia, do you want to mention how many hours a week you are seeing your companion?
Well, technically 20, but sometimes it's been more. It's been like 27.
You're busy.
And I have to turn people down sometimes because I already have appointments booked.
Right.
And there's a big need. There's a really big need. I mean, it's not just appointments. Some people have a friend in a nursing home, or they really want to see that's not doing so well, and I can take them for that type of thing.
Yeah.
And, it's very varied and flexible.
And sounds like rewarding work. So if someone wants to become a volunteer, how do they do that, Lauren?
We have a website. I didn't have that assigned to show it, but it's sparkthechange.org. When you go onto our homepage, under programs will be the Senior Companion Program.
Okay. And I can post that link later in the feed too. So people
And
can-
so you would be able to download the application. You can certainly call us, call me, and we can send the application to you if you aren't able to go online. And you can post that telephone number also.
Yes, go for it. Yes.
Okay, great.
Well, do you want to say
Sure,
it too,
it's-
just so we have it?
Yeah, it's 720-420-3717.
Okay.
And we also have an administrator. His name is John, and you can also call him, and his telephone number is 720-420-3212.
Okay.
So either one of us would be able to help with the application process.
Okay, and then for someone who has a loved one or is watching this and then they themselves want to be a client of the program, want to get into the program, how does someone qualify?
They can certainly call us, but we work with what we call volunteer stations. Olivia mentioned Kavod Senior Life. So we have a memorandum of understanding with them so that there is some oversight at that place, so that that's where Olivia would take her timesheets and things like that, or if there were ever issues, or, once again, if Olivia observes one of her clients, their mental health, like they're very depressed.
Mm-hmm.
She's an extra eyes and ears for the caseworkers, managers, and so she would be able to come to them. So we prefer working with those volunteer stations. As we mentioned, we're a new program, so we're up and running. We can still take the information from someone and see if we could fit them into one of the current 8 and growing volunteer stations that we have.
Okay. But not just a volunteer, but if someone wants to be...
Yes, they can call us.
Okay.
We may have to put them on a waiting list.
Okay.
And or...
Because more volunteers are needed.
Yes, absolutely. Volunteers are definitely needed. I just wanted to mention, too, about when Olivia was talking how she feels a part of the program. The corporation did a study, and they found that after members have been in the Senior Companion Program for 2 years, 84% of them said that they feel healthier or they have good health after they have joined the program, and that they feel 74% feel less depressed, less anxious. And I think, as Olivia will say, you have purpose, you're out doing things, and once again, so it's good for the client and good for the volunteer.
Right,
I
yeah.
need
So-
more Olivia.
And I've only been doing it since January, and not 2 years, but I feel better already.
Good. Yeah. You're probably making friends too, and
Yeah.
getting out to see people too. So definitely benefits you.